help them understand what to expect with UAE. So firstly, I'm sure everyone's wondering, is UAE painful?
Right, that's a very good question. And the procedure itself is not painful. The procedure itself can be done under local anesthetic. The only pain the woman have is actually the local anesthetic injection in the groin where we're going to insert the catheter. Once the catheter is inside the body, we don't feel that. We don't feel the catheter or the guide wire. We don't feel the contrast, right? And therefore, this procedure can be done just with a local anesthetic. But we do give the women some sedative because everybody's a bit nervous in the procedure room, so we want them to be comfortable. But the procedure is not painful. Now, yes, the pain is after the procedure. As I mentioned before, that you shut down the blood supply, the uterus is not going to like it, and therefore they can experience crampy pain like a severe period pain.
What does recovery look like, and what should I expect?
You need to be in hospital overnight for pain management, including a patient-controlled analgesia, so-called PCA. So the patient are given a button so they can press every 5 minutes if needed to get them through the night. The next morning, typically the pain is reduced because the woman started to recruit those dormant vessels. I mean, the normal part of the endometrium is able to do that, and while the abnormal part, of course, will shrink and die. So once those normal part of the endometrium can recruit an open blood supply, and the pain is going to ease. So some women might have pain for the next few days. People ask, this is a local anesthetic procedure, how come I need to take a week off? How come I'm expecting to have pain for a few more days? That's because when tissue is dying, they causes inflammation. Right? The dying tissue causes inflammation, and so the cells will be swollen before they shrink, and the inflammation can cause pain and discomfort as well. And therefore, we advise women to take a week off work. But typically by day 4, day 5, they're well enough to send the younger kids to school. They might do a short trip to the supermarket and cook a simple meal. So that's usually doable on day 5 or so. And if they're employed, they should be able to go back to work in about a week's time.
How effective is the UAE treatment?
UAE treatment is very effective for controlling heavy menstrual bleeding and period pain. Considering this is non-surgical, it can be done under local anesthetic and light sedation, and considering this is one night stay in hospital and 1 week recovery. So what we're talking about is 90% of women will be happy or very happy with the outcome of the UAE in controlling the heavy bleeding and in resolving the period pain. And quite often, women come back and report that the period either back to normal, lighter than normal, and quite a few women saying that this was the lightest period they ever had. Okay, so for them to be classified as a successful case, they need to be happy or very happy with the outcome. And for that, we have 90% of women saying that they're happy or very happy with the outcome at 6-month follow-up. And so it's also a durable procedure as well, because we've done a 5-year study. What we found is that those women who are happy or very happy with the outcome initially, and the success is sustained in 5 years period in 90% of cases. And in our experience, only 5% of women who had this procedure require a subsequent hysterectomy because of the insufficient effect. But in other words, 95% of women who would otherwise require hysterectomy because of the severity of the symptoms were able to avoid a hysterectomy. So that's 95 of 100 patients who otherwise would need a hysterectomy.
Will UAE help with my premenstrual bloating?
Yes. Premenstrual bloating is a very common symptom of adenomyosis. And the short answer is yes. And as I explained, so if you look at this picture illustrating adenomyosis, the endometrial glands is trapped within the myometrium. So this layer of endometrium thickens up towards the second half of the cycle. If the glands are trapped, you can see they're swelling against a confined space. So that's why they have this feeling of bloating. Yeah. So the UAE treatment treats every single bit of adenomyosis within the uterus. So we would expect the bloating sensation will improve if the bloating was due to adenomyosis. Bloating, unfortunately, is a very non-specific symptom. Bloating can be due to gastrointestinal cause as well. If the bloating wasn't due to adenomyosis, and of course, you might have residual symptoms. If that's the case, we need to investigate further.
How soon should I see the results for UAE?
That's a very good question. And typically, the first period is already no longer as heavy or as painful as before. But sometimes it might take 2 to 3 cycles to see the full result. So we usually follow up our patient at 3 months. So let them experience 3 cycles and see how they go. And so that's usually the case. To answer your question more specifically, within 3 cycles, you should see the result.
Is UAE durable treatment for adenomyosis?
Yes, we think so. And we published our initial data in 2018, documenting the success rate in treating 117 women. And that paper was the largest case series in English publication. That's why I'm saying we're achieving 90% patient satisfaction rate. We followed the same cohort of patients for 5 years, and we published again in 2021. So what we found is that those women who had an initial success, 90% remains good at 5-year follow-up. Only 10% have recurrence of symptoms. Recurrence does not mean full-blown symptoms. They can be just going backward a little bit. They're saying, oh, I used to use a pad maybe only 3 times a day, but now I'm changing 5 times a day, so that we say that's going backwards. If they say the pain relief was so good, I didn't need to take any tablets anymore after the procedure, but at 5-year follow-up, they say, oh, every now and then I have to take a Nurofen or Panadol, then we classify that as a recurrence. But the other way to look at recurrence is that how many more hysterectomy that we had at 5-year follow-up compared with the 2-year follow-up initially. And 2-year follow-up, we have 5% women who need hysterectomy. At 5-year follow-up, we only have 2% more of hysterectomy. So in other words, it is a pretty durable procedure, considering this is not surgical, considering this is such a minimally invasive procedure. And therefore, we were allowed to conclude in our paper by the editors in saying that UAE could be used as an alternative to hysterectomy, which of course we know is a definitive treatment in the past.
I also have fibroid.
Right. Fibroid is such a common condition. Fibroids is in 70% of women. And not every woman has symptoms. Perhaps maybe a quarter woman who has fibroid can be symptomatic. And rest assured that UAE treats both fibroids and adenomyosis. And in fact, 50% of the patients come to me for UAE has both conditions. And study has shown, interestingly, if the woman also has fibroid, their success rate is actually higher than those women who have pure adenomyosis. So having a fibroid is not a major issue. The fibroid can be symptomatic fibroid, meaning that the fibroid is in a location that we think could be causing heavy period and period pain. And quite often fibroids are just very small and they're sitting within the wall or outside, towards the outside of the uterine muscle wall. We call them bystander fibroid. They just happen to be there. Whether they're symptomatic fibroid or bystander fibroid, we found that it is just effective, if not more effective, to treat with UAE. So presence of fibroid is not a hindrance to treat adenomyosis with UAE.
Would UAE work if I had a previous ablation?
Yes, we have shown that it does work for previous ablation failure. What we noticed that there's quite a few women came to see us because they had previous ablation for heavy menstrual bleeding, but after the ablation, the bleeding has improved, but the period pain has gone worse. So quite often in that scenario, women were offered hysterectomy. But for those women who came to see us, we offer them the alternative, which is the UAE. So we have a small case series and of 18 women in that situation. We treated them with UAE as an alternative to hysterectomy. And 17 out of those 18 women were able to avoid a hysterectomy. Only one did not have good enough response and decided to go on to hysterectomy. So in other words, we were able to save a woman going through hysterectomy even though they have failed endometrial ablation for adenomyosis.
What if UAE didn't work for me?
Right. So let's put us into perspective. We expect UAE works outright in 90% of women, meaning that they don't need any other treatments. They outright happy or very happy with the outcome in resolving the heavy menstrual bleeding and reducing the period pain. So they don't need anything else. For those 10% who did not have the satisfactory outcome, typically they said, my heavy bleeding has reduced, but not quite normal yet. They're still somewhat heavy. So if they were in that situation, we tend to add on a little bit of other therapies. For example, tranexamic exit may not work for them before, but after UAE, they said, oh, I used to have heavy period for 7 days. I'm gushing out 7 days, passing clots. I'm fainting. But after UAE, they said, I'm only heavy for maybe a day and a half. Then we say, why don't we add tranexamic exit on those day and a half that you're heavy? So that's one way of dealing with it, right? Others, they say, okay, my period pain was 9 out of 10 for 2 to 3 days. I'm housebound, I can't do anything else. I'm swallowing Panadol and Nurofen, for those few days. But that has reduced to like 4 or 5 out of 10. And then we say, all right, if that's the case, let's see whether you take 2 Nurofens, maybe 2 or 3 times on those days that you still have pain. And quite often they found that it's manageable, meaning that before the pain is incapacitating and debilitating, but the pain has reduced. Yes, the pain hasn't gone away completely, but it becomes a manageable situation. And again, so they're happy with the medical therapy. Others who have failed Mirena before, meaning that it's so heavy, the bleeding, the Mirena, they're happy to have a Mirena, but a Mirena just didn't work, and they expelled Mirena due to a heavy period with blood clots. In those situations, they say, all right, after UAE, my bleeding has significantly reduced. I'm not passing clots anymore, and but it's still somewhat heavy. I would like that to be a bit more, a bit lighter than what it is now. Then we say, all right, Mirena didn't work before, now the bleeding has reduced, you're not passing clots anymore, why don't we add Mirena on top of UAE? So quite a few percentage of women has responded to the Mirena on top of UAE kind of strategy. But of course, there are a small percentage of women and they don't want to do any more medical therapy and they don't want a Mirena. Then we offer them 2 other choices. One is a repeat UAE. Okay, so it can be repeated. It's a treatment. We just go back and do the same thing again. And we found in some women, and they respond to the second treatment, and to achieve a satisfactory outcome. And this is particularly the case for what we call the giant adenomyosis. huge uterus. As you know, normal uterus is about 60 to 80 mil. Sometimes they come to us with uterus 500 mil, 700 mils. It's almost like 10 times normal size. We don't want them, one treatment may not be sufficient. Okay, so one treatment may not be sufficient in the sense that the symptoms hasn't gone away completely. In another sense that it's probably good for maybe 2 years, 2.5 years, and the symptom might come back. So those are the situations we offer the woman the option of a repeat UAE. So I think then left with us a very small percentage of women, probably less than 5% these days, that we fail everything else, and hysterectomy is the only solution for them. And that's really single digit, I would think less than 5% of women that end up needing a hysterectomy as the last resort.
What should I do if UAE has worked for heavy bleeding, but there's still period pain?
That's an excellent question. Fortunately, that's only in less than 10% of women in that situation. As we mentioned previously that endometriosis and adenomyosis can coexist, right? So they can both cause period pain, but it is the adenomyosis that causes heavy menstrual bleeding. So if we done the UAE and she said, look, it's amazing, my periods has reduced, but my period pain is still significant. So what does that mean? That means they responded, the adenomyosis has responded to the UAE. The residual pain is probably related to the endometriosis, which UAE does not treat. So a small percentage of women, they might need laparoscopy to treat the underlying endometriosis. But just bear in mind that UAE is non-surgical, local anesthetic procedure. It treats both heavy period and period pain. A laparoscopy treats only endometriosis and is a keyhole surgery. It's a major surgery. It has to be done under general anesthetic. There has to be 3 keyholes, right? So it is an invasive test, but it's of course a treatment for endometriosis.
Why do I need to have a MRI before UAE?
That's a very good question. And now, depends what we're doing the UAE for, okay? If the UAE is to treat fibroid disease, and the MRI is crucially important. In other words, if there's a lump in the uterus, MRI is essential, because we know that fibroid is a presumed benign condition, but there is 3 per thousand. There's 3 per thousand chance the fibroid is something nasty. Okay, ultrasound cannot tell. Okay, the rate of growth, how big they are, how ugly they look like on ultrasound, cannot tell one way or the other. The only way to tell is a newly developed MRI algorithm using diffusion weighted imaging, or DWI, to distinguish a lump in the uterus, whether it's just benign fibroid, adenomyosis, or it's something nasty. So that's one of the major reasons we want to do MRI. For adenomyosis, quite often the ultrasound did not pick up the diagnosis, or the ultrasound signs are so subtle, the radiologist or the sonologist are unsure of the diagnosis. So we want to know the definitive diagnosis before we treat. We want to confirm the diagnosis, and then we want to do an MRI. But if the ultrasound has demonstrated typical signs of adenomyosis, and there's really nothing else there's not a focal lump in there that we need to sort out what it is, and the ultrasound could be sufficient and for us to establish the diagnosis of pure adenomyosis, and then to plan for treatment accordingly. Yes, should we remove the marina before UAE? The short answer is no. And therefore, it doesn't interfere with the procedure. We don't believe that increased the risk of infection, so we don't remove the marina before the procedure. In the unlikely event that we think there's a uterine infection after the procedure, which is exceedingly rare anyway. It's never really proven for adenomyosis. And then we, of course, remove the Mirena IUD. The other reason we don't want to remove the Mirena IUD before UAE is because once you remove the Mirena IUD, you tend to have what we call the withdrawal bleed. That can be quite a heavy bleed, and that's not a good situation. So if the women are having side effect of Mirena, we tend to ask them to perhaps bring the UAE procedure forward, treat the uterus with the UAE, and then remove the Mirena after UAE.
What is the follow-up schedule after UAE?
And we of course, after the UAE, I'll see the patient in the ward the following day, and typically they get sent home. And we touch base with the patient in about 3 months' time. Because most women will be doing fine, so they really don't need to come back and see me. And they just have to reply email, I'm doing fine. If that's the case, we send them a follow-up imaging request. That's typically MRI to be done at 6 months before coming back to see me for a review.
Why is UAE not mentioned by my GPs and gynecologists?
Yes, unfortunately, there's huge lack of awareness of this much less invasive therapy. See, GP usually refer the cases to gynecologists because obviously heavy bleeding, period pain, adenomyosis, fibroids are gynecological problems. So it's GP will naturally refer, we offer the patient conservative therapy first, right? Medical therapy first. If those treatment fail, and typically a GP will refer them on to gynecologists. UAE, unfortunately, is not performed by the gynecologists, right? UAE is done by interventional radiologists, not by gynecologists. So gynecologists may not be familiar with this procedure. Certainly, it's not a procedure that they do. So usually we try to look into our own toolbox and see what we can do with whatever tool that we have, and that's natural. So because they're not familiar with UAE and they haven't really referred UAE and they don't have the experience, and they tend not to talk about it.